240 patients are still hospitalized. 95 patients are cured and discharged from hospital. 21 asymptomatic cases are under medical observation. Right now, for 14 days in a row, Beijing has reported a digit number increase of new confirmed cases, and also for 6 days in a row, there is no new confirmed cases. And we have kept increasing the number of cured and discharged patients. Right now, the epidemic prevention and control situation in Beijing is trending positive. However, we are still seeing the global pandemic is accelerating. In Beijing, we are still facing a daunting task in preventing and control the epidemic. We also have to show strong determination in fighting against the virus. At the same time, we have to prevent imported infection and domestic transmission. We have to remain vigilant and do a good job in regular prevention and control work. We have to give full play to the medical institutions. We have to implement the 4 early measures for the fever clinics, hospitals, medical institutions. They have to lead the public to conduct the screening and making sure that we can realize early detection, rapid response, targeted control, and effective treatment. We have to give full play to the fever clinics, making sure that we can screen all people that need to be tested. So the medical staff, they have to be the goalkeeper for this epidemic. For the rescue center, they have to arrange medical resources to transport the patients and also conduct the disinfection to all the public facilities, making sure that there's no inter-hospital transmission of the virus. In order to do a good job in the regular prevention and control work, we have to improve our efforts for the disinfection. In our efforts to fight against the epidemic in Xinfadi wholesale market, a good disinfection can help us to curb the transmission route of the virus and also protect the susceptible groups. We have to implement the 4-party responsibility and continue to strengthen our efforts in disinfection for the shopping malls, wet markets, and other key public facilities. We have to increase the frequency of disinfection and also improve the ventilation and monitor the health condition of people who are working in those areas. This will also help to restore the order of our life and social and economic activities. In public facilities and areas, we also have to roll out the patriotic health campaign to making sure that we cut the route of transmission of COVID-19. So everyone has the responsibility to prevent and control the epidemic. So first of all, you have to mind your own hygiene so that you can make contributions to fight against the COVID-19. Right now, we are at the summer vacation time, but still we have to remain vigilant, making sure that we can take the lead for the prevention and control work. We have to enhance our awareness of prevention and control, to mind our own hygiene, do a good job in disinfection and ventilation. We have to wash our hands frequently, wear a facial mask, and do not gather. All of this can help us to contribute to the regular prevention and control in Beijing City. Today, we have invited representatives from Beijing CDC and also people from local hospitals to attend this press conference. They will brief us the latest situation about the epidemic prevention and control in Beijing. First, please allow me to introduce our speakers. So they are Madame Pang Xinhuo, the Deputy Director of Beijing CDC, President of Tsinghua Chang'an Hospital, Mr. Dong Jiahong, and the Beijing Disease Control Center, Mr. Zhang Wenzhong. First, I would like to give the floor to Madame Pang Xinhuo to brief us on the guidelines on shopping. Friends from the media, good afternoon. Right now, I would like to give you some update on the epidemic in Beijing. From 0 o'clock to 24 o'clock on July the 11th, there is no new confirmed cases in Beijing. And for 6 days in a row, Beijing has reported 0 new confirmed cases. Right now, Beijing has entered into a regular prevention and control right now, and also we have a classified management for different districts. From Lugouqiao, Fengtai District, Daxing District, Weishanzhuang Town, Daxing District, Gaoyundian Street, for 14 days, they reported no new confirmed cases for 14 days. So for these 3 districts has been adjusted from medium risk regions to low risk regions. Right now in Beijing City, we have 1 high risk region, that is the Huaxiang Town of Fengtai District, and we have 9 medium risk districts: Lugouqiao District, Majiapu District, Xinchun District of Fengtai District, Huangchun Town, Qingyudian Town, Xinfeng Street, Xihongmen Town of Daxing District. So for other streets outside of Daxing and Fengtai District, they are remained at the low-risk regions. And recently, there has been reported that there is an increase of workers who have been infected with COVID-19 who are working for the fruits and the shrimp companies. And also, we do see some of the virus has been tested on the package of some of the shrimps. So I would like to remind all the residents, please make your purchase from those qualified shops. And when you are going out, making sure that you wear your facial mask and bring a clean shopping bag. And when you are using the trolleys and baskets provided by the shopping malls, making sure that you disinfect all the handles of those baskets and the trolleys. When you shop, please make sure that you have a 1 meter distance with the others. When you are trying to buy fresh products, make sure that you are wearing the disposal gloves, or you should use a plastic bag when you are touching those food. Please do not touch the food with your bare hand. And when you are packing the meat and other fruits, making sure that you separate the delis, the meat, with other vegetables. And also please check the shelf time for all of those products. After you complete your shopping, make sure that you wash your hands thoroughly. When you're coming back home, make sure that you wash your hand. By doing that, you can avoid contamination from your furniture at home. Making sure that you do not purchase or eat any wild animals. Making sure that you protect the wild animals. Dear residents, everyone has the responsibility to prevent and control the epidemic. So please attend to the details and protect your family members, and so that we can consolidate the hard-won achievements. Thank you. That is my update. Thank you for Madame Pang Xinhuo's introduction. Now I would like to give the floor to the president of Tsinghua Chang'an Hospital to give us some updates on the prevention and control in Beijing. Friends from the media, good afternoon. Since the outbreak of COVID-19, the Party Committee has attached great importance to the prevention and control work in Beijing. We are working together with the Health Commission of Beijing and the Tsinghua University. We have improved our mechanism for the prevention and control. We attach great importance to the medical treatment as well as the epidemic prevention and control. We are also adopting a science-based approach for the medical treatment. So by taking all of that, we are realizing zero infection inside of our hospital. First, we are taking science-based approach in our medical treatment work. So on one hand, we focus on the medical service. On the other hand, we focus on the epidemic prevention and control. We are sustaining a normal operation of the outpatient wards, and at the same time, we are also provide a lot of support to vulnerable groups. We're also optimizing the diagnosis procedures for all of those vulnerable groups. We're standardizing our procedures and providing better services to the patients, making sure that people who are with underlying disease, they can receive a timely medical service from the hospital. As of July the 11th, we have received around 30,000 patients from the outpatient wards, and also we are receiving around 8,000 patients who are under severe condition. And also we are completed about 5,800 surgeries, including 379 emergent surgeries and 121 surgeries to the pregnant women. And the second, we also make good use of the artificial intelligence for the epidemic prevention and control. Since the outbreak of COVID-19, Xinhua Changgeng Hospital immediately set up a doctors' association to conduct telemedicine to provide services to people who are under infection. And also we are donating a number of medical equipments to different provinces and cities. Altogether, in 7 categories, we are donating intelligent equipments to different provinces. So all of these equipments can help us to improve the screening, testing, epidemiological investigation, and virus tracing for the virus. In order to meet the needs of the frontline medical workers, we are also working with 12 hospitals. We are conducting investigations on site, and also we are making a lot of investigation and R&D on how to follow up with the situation of patients who are discharged from the hospital. And third, under the situation prevention and control mechanism, we are responding to the requirement from the leading group of the epidemic prevention and control of Beijing Municipality. On April the 30th, we have set up a NAT laboratory, which takes up 180 square meters. So on a daily basis, we are able to analyze 5,000 samples. And also, we are sending a medical group to visit the different districts to facilitate with the NAT. So as of yesterday, we have completed sample collection with around 70,000 people. And fifth, we are working with Tsinghua University and conduct autonomous R&D and develop an intelligent system. So for patients who are coming to our hospital, they can use their mobile phone to check in different procedures. So this will help to promote the contactless medical service. So we are making good use of modern technologies, and also we are organizing a number of telemedicine conferences with other universities and hospitals. We are working together with the Fudan University to exchange our views on the epidemic prevention and control. By having all of these teleconferences, it can help us to improve our capability. Going forward, Xinhua Changgeng Hospital will continue to fulfill our duties in the epidemic prevention and control, and we will put people's health and security as our top priority, and also make greater contributions to fight against COVID-19 in Beijing. Thank you. Thank you for Mr. Dong Jiahong's introduction. Now I would like to give the floor to Mr. Zhang Wenzhong to brief us on the situation about the transportation of the patients. Friends from the media, good afternoon. Since the outbreak of the epidemic, we are facing with a daunting task in transportation of the patients. For Beijing CDC, we have to pay attention to 4 groups of people, and also making sure that we can transport these confirmed patients, suspected patients, or fever patients to designated hospitals. So we actually initiated our work from late January in accordance to the requirement of the leading group of the epidemic prevention and control. We are actually arranging medical resources in different key public places, and we are working 24/7 to facilitate with the transportation of the patients. And also we are providing a well-rounded trainings to our staff. We are managing our staff and also conducted a thorough disinfection to all the ambulances. As of yesterday, we have increased the number of negative pressure ambulance. Right now, we have 122 ambulance, and altogether we have been transporting around 20,000 patients. By doing all of that, we are making sure that we do not have any inter-hospital infection. And since the cluster outbreak occurred in Xinfadi on June 11th, the Beijing CDC fully adopted the regulations of the nosocomial infection management. We have increased the number of ambulance, and also we have a team of 84 people who are responsible for the disinfection for the ambulance. For different ambulance, we know that the temperature is very high, and also our medical staff, they are working diligently and making sure that all the confirmed patients, suspected patients, and asymptomatic carriers can be transported in a safely manner. In order to be proactive in fighting against the virus, we have made some upgrades in the template of the epidemiological investigation. For example, we asked the patients whether they have visited overseas countries or whether they have been visited the Xinfadi wholesale market in the past 14 days. So all in all, we are providing a strong support in identifying the confirmed patients, suspected patients, and the fever patients and other people. During the transportation of these patients, we are monitoring the body temperature for the fever patients, and also we are checking down on the health conditions of their family members, making sure that all the information can be collected. And for people who are under severe conditions, we will conduct medical treatment immediately. We are also open up a green channel to the fever clinics. For people who are under severe condition, we will transport those people to designated hospitals. When monitoring their health condition, at the same time, we are also providing some psychological counseling to these patients. When considering the needs of the patients, we are adjusting the working schedule for the medical staff to making sure that we can provide a better services to all the patients. When we are fulfilling our mission to transport the patients, we are also helping with the municipalities to prevent and control the epidemic. Going forward, we will keep up with this good momentum and also will respond to the guidelines released by the leading group of the epidemic prevention and control of Beijing Municipality. We will make sure that we put people's health and safety as our top priority, and also safeguard the lives of people who are living in Beijing. Thank you. Thank you for Mr. Zhang Wenzhong's introduction. Now is the Q&A session. Please identify yourself before you ask the question. With Beijing Radio Channel, and my question is to Mr. Dong. So can you tell us about the diagnosis system that has been operated under the Xinfadi Chang'an Hospital? So first of all, thank you for your question. So we are a 3A hospital in Beijing. We are also taking up the role for the epidemic prevention and control in Beijing. We have taken 5 important measures. So first, we have a diagnosis and treatment guidelines to people who are falling into different categories. For example, if people are under severe conditions, we will also provide a different guidelines and to support these people to seek medical services. Especially, we attach great importance for the medical treatment for people who are under severe and critical condition. At this time, we also develop an intelligent system to facilitate the patients to seek a doctor. Because right now the situation is very severe, we have to make a categorization of different kinds of patients. And also, we are doing what we can to make sure that all the critical patients can be treated. For example, if this patient needs to have a hemodialysis, we're making sure that these people can receive the treatment in a due course. And if these patients are not severe in their symptoms, maybe we will advise these people to wait, and then we will monitor their health condition. Also, we have set up a special channel to track down with the patients who are with tumor. At the same time, we are setting up an online platform to monitor the health conditions of the patients. We will monitor the health conditions. By doing all of that, we can make sure that our medical systems will not be affected because of the COVID-19, and also provide good services to all of those patients. So that is the end of the Q&A session. This press conference is organized by the Information Office of Beijing Municipality. You can also watch this live streaming online through multiple media platforms. For example, you can watch this live streaming on Beijing Daily, Beijing News, Xinhua.net, China.daily, CCTV application, CCTV finance, and CGTN as well. And also this live streaming is available in a couple of radio channels, including the FM 1039 and FM 1006. You can also follow us on BTV News. Thank you for all the speakers, and thank you for all the journalists. That's the end of the press conference.